Welcome to the next lesson in the First Aid, CPR, and AED unit. In this lesson, we'll learn how to use an AED. An AED is an automated external defibrillator which analyzes a heart's rhythm and delivers a shock to a person only if they need a shock. In other words, it does not deliver a shock to a person who does not need a shock. This shock may cause the heart to start beating again, which can bring someone back to life without potential brain damage. This video will go over how to use an AED machine. There are several parts of an AED. It may or may not be in a case. There is the power button, pads envelope, along with the pads, a connection cord to connect the pads to the device, and a shock button. When using an AED, it's important to place the pads in the correct position so it gets an accurate reading on the victim's heart rhythm as well as delivers a shock. You will place one pad in the patient's upper right chest and the other pad on the patient's lower left side. The pictures of where to place the pads are also located on the pads themselves, so it's very easy to place them. There are some special considerations that we need to take into account when preparing to use an AED. We do not want to use an AED if a person is lying in water, so it's important to move the patient to a dry area if that is the case. We also want to expose the person's chest. We cannot place those AED patches on any clothing. If the person's chest is wet, we want to dry off that person's chest before applying those AED pads. For large amounts of chest hair, you may have to shave it off, although this is very rare. Lastly, we need to account for any jewelry that is in the chest area. We will want to remove any jewelry that is on the chest. An AED is very safe and easy to use. It's safe to use because it will not deliver a shock unless a person actually needs a shock. So you can't accidentally shock someone. An AED is also easy to use because it has voice prompts that tell you what to do once you turn it on. The AED pads also have pictures on them so you know where exactly to place them. There are some differences when using an AED on a child. Many AEDs come with two sets of pads. One set will be for an adult and one set will be for a child. The child pads will have a child drawing on it. Some of the newer AEDs also have child pads, so they are in the front and back of the child. These pads are to be used on children 0 to 8 years old or less than 55 pounds. If the child is older than 8 years old or weighs more than 55 pounds, you will want to use the adult pads on that child. However, you can use the adult pads on any children if no child pads are available. This video will go over how to use an AED on a child. This is the end of the AED training. Please go to the First Aid, CPR, and AED folder and take the quiz.